My name is Jason Foster. I grew up just outside of Pittsburgh, Pennsylvania. I went to undergraduate school at Bucknell University and subsequently went on to medical school at Temple University in Philadelphia. I then migrated to the Midwest, did my residency at Case Western Reserve University, and from there I went on to do my surgical oncology training at Roswell Park Cancer Institute in Buffalo, New York. I come from a large family, 9 brothers and sisters, with a large extended family, and we often had family members and spent time in hospitals. And it was there that I actually got to see the profession, the importance of not only being good at what you're doing in terms of patient care, but also the importance of effective communication with educating patients to do the right thing, but also with communicating with families in times of stress as well, with tough problems. I treat a spectrum of diseases. This extends from skin cancers induced by sun and dealing with the primary tumors or when they spread to lymph nodes or other parts of the body. This also includes soft tissue tumors of the trunk or the extremities. The other hat that I wear is I'm a GI surgeon here. I treat a variety of gastrointestinal conditions from the stomach, pancreas, liver, and colon in the primary setting, as well as tumors that metastasize to the liver. But one of the unique things that I offer here at the Med Center is we have one of the few medical centers that specializes in peritoneal surface malignancies, which is when these GI tumors spread on the surfaces of abdominal organs and require multiple resections. These procedures often require several hours to remove the cancerous portions, but this surgery is also combined with intraperitoneal chemotherapy, which is primarily to treat the microscopic cancer cells that are the origin of these tumors. I think we're fortunate here at Nebraska Medicine to be at one of the top institutions in the country. Here we have full compilation of a major academic center. One of the things I enjoy is teaching the residents, and I can provide an opportunity to educate other students as well as residents who may go on and do surgical oncology or other things in surgery. In addition, what we have is an environment where we can work together as clinicians with excellent medical oncology and radiation oncology to combine our surgical skill sets with that to improve the outcomes of patients. Also, we have a phenomenal research environment here in terms of working with dedicated researchers at the bench to not only identify new treatments, but also we have a clinical trials capacity to implement some of the emerging treatments and offer this to patients in this region. I have one of the best jobs that you can have. Sometimes we meet patients in unfortunate circumstances. Clearly, when you hear the cancer diagnosis, that's very stressful. But I think it's my job not only to treat the patients, but get them to understand their diagnosis. And I can't always surgically correct conditions for patients, but the one thing I can do for every patient is get them to understand their disease, understand what's necessary to treat their disease, and remind them that they're still living and that they still have potentially a long life ahead of them, and not just be confined or defined by the diagnosis of cancer.